So my job today, I work at Franciscan Health Outpatient Pharmacy. So we service, we're a typical pharmacy like a CVS or Walgreens where it's open to the public. A lot of our patients are employees of the hospital because they do get a benefit with our insurance. So it's great interacting with them throughout the day as patients who are also healthcare providers. And then we also offer a meds-to-beds programs. So when you are at our hospital and you get discharged, we offer to fill your take-home medications. So we work with the inpatient clinical staff to make sure, one, that the medications make sense for them going home, that they're affordable, whereas you don't get that at another pharmacy. So working with them as the inpatient side, we go up to the bedsides, we offer delivery, we'd offer counseling at the bedside so we can kind of troubleshoot anything prior to them going home. I would say this job is a lot more clinical, so we have access to the electronic medical record that Franciscan Health uses, so we can understand when an allergy pops up for us that they are allergic to codeine. We can actually get in there and see what was documented, see that they were taking it in the hospital but doing okay with it, so we have confidence to dispense it versus just going off of a caregiver who's come to pick it up and said, I don't know, I think they did fine on it. So having those tools are great. I'm also working with the staff, the inpatient pharmacy staff, the clinical pharmacists on the floor. We work as a team to make sure we're giving that patient the best care possible. I think in terms of career options for a pharmacist, that it's really endless of what you want to do and where you want to go. I have a couple friends in public policy trying to change laws and making pharmacists have greater prescribing habits. Also in industry, academia, wherever your passion is. My passion is I love working with the public, I love working with people. So my first job at Walgreens, it just clicked, and I think Purdue does a wonderful job with giving you a lot of different experiences on rotation so you can see what you like and what you don't like. So when I was going through my rotations, I always came back to, I just really wanted to go work at a community pharmacy. So there's a lot of different avenues, business mindset for people. My boss is a pharmacist. He opened up 5 pharmacies in a couple months, and now he's doing business plans, and so it's really endless of what your passions are and where you can go with a science background. I think at the end of the day, you're always going to need pharmacists. So the healthcare system is changing. It's changing fast, but you're always going to need a pharmacist to have that critical thinking to make sure that the right patient is getting the right drug at the right time. So yes, machines can count pills, but to have that critical thinking skill, it's always going to be needed in today's healthcare. So I think there's always avenues for a pharmacist to go into, especially now people are realizing the benefit of a pharmacist and seeking them out in different avenues such as public policy, nuclear pharmacy, academia. So there's a lot of avenues that a pharmacist can go into, especially having the Purdue name that helps them open doors. So Purdue offers that big school feel of collegiate sports and all sorts of extracurricular activities, but you also have that family feel of the pharmacy school for having to know that people want you to succeed, are there for if you have any problems. So you have the big school opportunities, but the small school feel.